All right, well, good morning. Today we'll be talking a bit about substance abuse disorders. There's a change in the way it's described in DSM-5. If you don't know what DSM-5 is, this is the Bible in psychiatry. It's purple in color. Women like purple color, so it's made especially for a woman. Do you like purple color?
I do, yes.
You do. Wearing somebody else is wearing it, right?
Yes, exactly.
How much do you like the purple color?
It's my favorite color, so
Your favorite
a lot.
color. Okay, so this is called addictions to purple color, right?
Yeah.
So anything that we do, what is addiction? I mean, when we say people are addicted to something, or they're just, what does addiction means in a psychiatric terminology?
It means that your mind and your body are physically dependent on a certain substance or activity, something of the sort.
Okay. So if a diabetic is taking insulin, are they addicted to insulin? Tough question. You weren't prepared for that. What would you say? If somebody's taking
I
insulin
would
for the diabetes?
say they were dependent on it. They're not necessarily addicted to it.
Correct. So there's a difference between something and what's the difference between the two?
When you're addicted to something, you don't necessarily need it, so you're introducing a foreign substance to your body, which your body gets used to, and then you essentially end up needing it to get through your day.
Correct. And what does it do for people's lives?
It kind of puts them on a downside, so they end up searching for a certain substance because they can't make it without it.
Okay. So it's a board question. What are people searching in Colorado these days?
Colorado, there's a big marijuana issue.
Marijuana? You call it an issue? They call it an initiative.
Yes.
You must be a healthcare provider. So I actually was getting ready to get my plane ticket to Colorado so that I can find some what? Marijuana. Yeah, that's a blissful weed. It's all natural, so it must be all good. So we kind of get into all these national debates about controversial issues, and our nation has gone through the prohibition for alcohol at one time. And to me, it really is not an issue of science. Today we are going to be talking about science and its value, rather than a political dimension and what people may want or not want. That really is a very different dimension. So our job as a scientist is really to keep the politics out of science. And the science is that people are using a substance, taking something which is not meaningful, causing difficulties in their life, such as?
They often become withdrawn from social activities. They can have issues with their occupation, not showing up for work, or their just daily life, their family obligations.
Absolutely. So if somebody's a teacher, how they might behave in their teaching profession then? What do you know about addiction? Do you know much about addiction?
I'm acquainted with it.
Acquainted with it, right? And then how do you feel that these things affect people's lives?
Affect their lives. It affects every facet of an individual's life. It can lead to serious financial issues, involvement with the legal system, social interactions, interpersonal relationships, across the spectrum.
Anything with the health. I mean, say if somebody's an alcoholic.
Oh, absolutely.
Yeah, give me some examples of that you have seen or known.
Well, if you're an alcoholic and you go into acute withdrawal because you're not able to access, then you could go into delirium tremens.
And
you could die.
And die. It's a serious matter, right? So dependency can lead to some serious health consequences. And what other medical complications people can have? And we talked about psychosocial complications, occupational, and what kind of medical complications people can have.
Well, specifically with alcoholism, you could end up developing liver complications.
Right.
Yes.
Yeah. Why liver? Why does the liver get damaged then?
Because that's where the alcohol is processed.
So liver is a lab. You know? Liver is a lab where all the biochemical things. So it draws blood from what part of our body. I mean, it gets the portal vein comes.
Um,
I mean, we get the gut juices, right?
Mhm.
And all that gets getting absorbed. So all the medicines go through that. All the drinking and the drugs. So most of those things really are processed in the liver, right? Okay, so liver, if it's a happy liver, it's a healthy liver, right? You know, but if it's damaged liver, it causes problem, right? Cirrhosis and whatnot, you know. So there are complications not only in relationships, but there are complications in our healthy, in our body's health as well. You know? Does it cause any problems in our neurological system?
Yes, depending on the type of substance you're addicted to.
Okay.
You can end up having psychoses from being dependent on alcohol for a long period of time.
So it can cause, you know, depending on the system that we are focusing on, from cardiac conditions to neurological conditions to you know, peripheral, you know, kind of even the blood, you know, I mean, I would say the hemopoietic system, and so all the systems can be affected by the use of a chemical, right? So these are toxic compounds which have toxic impact on our psyche and on our body, right? Okay. So then why do people use them? I mean, if we know all that stuff, I think everybody knows the cigarette is bad and that is bad. Then why do people do that? I mean, you were not prepared to come in and get in on this issue, but who cares? Just tell us what you know.
I think sometimes it starts as like a social thing.
Okay.
Everyone's doing it, so they do it, and then they don't plan to become addicted, but it just happens. I think as far as alcohol, sometimes it's a coping mechanism if they're depressed about something or if they have certain things going on in their life, and that kind of masks it or takes it away temporarily, and then
Absolutely. So we do something because it does something for us, right? It does something. Otherwise, we would not be going out and then using a compound just because of for the fun of it. Nobody goes out and starts eating a plant, you know, I mean, a pine tree. you know, I mean, there must be some chemical qualities to that substance, and it does something for us to sustain that, right? So it could be recreational use, and then it comes everyday use, peer pressure and whatnot, you know. Obviously, when we were growing up, you know, smoking was seen as a fun thing, and almost a sign of rebellion, you know, that I'm going to rebel from my authority. Everybody says don't do these things, and you want to figure out why, you know. And so that's that aspect. And a lot of people will experiment, but then they move out of that experiment and move on with their life. But some people get addicted to these things, right? You know. It's kind of an advanced sciences question, but I'll ask that anyways. So sometimes people will experiment with everything, but end up using just one kind of a thing. You know, so they may just use amphetamines, right? Or cocaine, or alcohol, or marijuana, or you know, narcotics. Why is that happening? This is an advanced question, so I don't expect anything. But think about that anyways.
They might just be genetically prone to
Good girl.
enjoying a type of substance, and that's why some people get addicted to things versus others.
Absolutely. So there's a genetic predisposition. Then there is obviously, if somebody is anxious, what kind of compounds they might be more likely to use. If they're having panic attacks and anxiety attacks, and they're very nervous kind of people, do you think they will use stimulants or they will use anti-anxiety kind of medicine, right? Okay. So for them to get addicted to a stimulant is going to be very low chance, right? So somebody has attentional difficulties and they cannot focus, what do you think they might end up using?
like the
Like a stimulant.
Stimulants, right? You know, so stimulant. So it's in other words, our inner issues of whatever those are, we may have more likeliness to use one or the other compound. You know, difficulty sleeping, alcohol. You know, something would be nicer. Pain issues, psychological or physiological, narcotics. You know, so they'll be more likely to do that. You want to say something? I can tell. If not, just say it anyways.
What we call it, what you named earlier, is we call that a drug of choice. And people originally used because there's some effect that's produced by that substance that fill some type of a need in their life. They feel a need. They feel they have a need.
Absolutely. Does that make sense, Steve?
Yeah, that makes sense.
Yeah, yeah. So knowing that is the architect of knowing what a chemical is, why a person is taking it, what is it doing for them. Now, why is that important for treatment perspective?
Why is what type of substance they use?
Yeah.
Well, you have to use certain treatments to deter people from using certain drugs. So sometimes if they're addicted to, say, a stimulant because they have trouble concentrating, you need to address the underlying cause also to address the addiction.
You get one more A+ in the moment. That can change any time. But that's very important because you cannot take away something from somebody without giving relief for the symptoms that they're experiencing. So if I can't sleep at nighttime and I'm all awake and I'm very anxious, I'm having panic attacks, and you take away my substance that have been helpful without giving me something instead, I cannot stay happier, right? So if you take something away, you give something even better, right? If you're flying to Las Vegas because you had a vacation of a week, and they say, well, sorry, ma'am, we are overbooked. Anybody wants to take, can want to stay here? You would say, why should I leave my flight and a plan, right? But if they we'll give you 2 round trips and $500, what's the chances of you? Pretty right? Because something better to let go of your own plan. So we always in treatment give people something even better, a better choice to be making. Actually, I was seeing somebody just moments ago, and we are trying to help him stay clean from alcohol. So we're giving something better to him. And those better things come in different shapes and forms that we do in therapy context. You want to give a little maybe peek into what therapies are better for people who struggle with addictions?
Well, it's clear maybe we take a little different path. Generally, the modality for treating people in addiction has been more a harsh type of direct approach and telling a person what to do. Here at Sinclair, we first we don't generally look at the addiction, we look at the individual. And our philosophy is to treat a person with positive regard. We may not accept the behavior, however, we always accept the person. We treat them with courtesy and respect. We treat them as a worthwhile individual. And here at Sinclair, what we offer, we don't want to change a person, we offer them life enhancements. And we look at all areas of their life. We take a holistic approach: mind, body, spirit. Which areas can we improve? What can we offer to fill that void?
Okay. So the sciences that really kind of qualifies to be the bedside manners, how we treat an individual with respect, dignity, and good sciences. So this individual that I just saw, I have him on antabuse, that's a medicine, to help people withdraw or not use or become sick if they were to drink. So we use medicines at time, then we use psychotherapeutic approach, and where we bring in the families and support them to be able to get better. It's no different than somebody had a broken bone. Their family would want to know what to do next. And so we help people, with their broken hearts and broken bones and broken feelings, understand how to manage them more effectively. Families want to know so that they can support. The job wants to know so that they can assist. We don't disclose information which are personal, but we let people know that people are in treatment, getting themselves together and better without humiliation and shame. And last but not least, treatment for addictions have very powerful outcomes. More than 80% of people do get better who get engaged in treatment. The results in psychiatry are very powerful for antidepressants or treatment for addictions. It's a matter of knowing that treatments exist, that their delivery has to be done right, and efficacy is there. So with that said, we can talk a lot more about addiction, but addictions are fun to have, right? Because they will seep into medical conditions as well. You can be an orthopedic surgeon and have a broken bone because of an accident, but because somebody was intoxicated and they were driving. So you really are not going to be escaping from the impact of addictions in everyday living. And so thus knowing addictions is fun, because it's there. And learning how to navigate them with wisdom is a beautiful, because it then gives you the knowledge of empathizing, understanding, and treating people effectively. So with that said, we have a comment to make here. Find out more at cclear.com. Follow us on Google for these, Google Plus, not just the single Google, for these videos, and to join us live Mondays at noon hours, so you can ask questions for us to answer during our discussions. Thank you, Mr. Mike, to give me this comment that I made without any hesitation.
And we did have a comment from Sven in the Q&A that says, I'm addicted to this podcast.
Yes, and that is an accurate comment, and there's no hope for Mike. No. Thank you, Mike and Sven and Omer and those who are here, and thank you for preparing, and thank you for diving into this conversation without knowing what you're getting into today. All right.